People seem to be really concerned when they're having surgery about different precautions and things that we may do after surgery to restrict their motion. And initially, we would do this on every patient, particularly in hip replacements, because we felt that it decreased some of the complications, such as a dislocation where the ball comes out of the socket. In particular, the type of approach we're talking about is a posterior, and more recently, the mini posterior, which is a smaller approach that comes in almost from the side, but then goes around to the back of the hip. So I thought I'd take a second and just touch on what some of the data shows. There's a great study that came out 2 years ago in Journal of Arthroplasty. It looked at just under 600 patients. One of the things they looked at is dislocation rate, and they did not see a difference whether they used posterior precautions, in other words, restricting patients' movement after surgery, or whether they didn't. Now, there's another one that I like. This is a couple years older. The summary of this paper is basically that there was no difference in terms of dislocation rates, whether you gave people precautions or not. And there was also not a difference in outcomes. And that's looking at multiple different studies. So you might say to yourself, well, do you use precautions or not? It's a difficult question because I think the data shows we probably don't need to do that. And there's probably no difference in complication rate or outcome. When you're treating a large population of people, we have to think about ways to limit any sort of a complication regardless. So I usually do still use precautions, more generally, more of a discussion point that we have with our patients, but there's probably not going to be any issue.